So this is just some general questions about um, the spider remedies and some of your work.
Mhm.
Um, so in your clinical experience, how do you clinically differentiate um, the spider remedies and the insect remedies? Because this can sometimes look comparatively closer. They can be restless, they can be hyperactive, so many similar points. Of course, we know that spiders are much more rhythmic. There are kind of connection with
Mm.
the music, but your experience about this broadly.
Yeah, it's a very interesting question. I hope to be able to answer you quickly. First of all, I do not consider insects a family,
Mhm.
not in the common way of what a family is, for a very simple reason. First of all, you should think that insects represent the 70% of animals on this planet. 70% of animals are insects, okay? So there are so many and so different ones, not just as animals, but as remedies. So in common, you can see something, the burning pains affecting the genitourinary tract and so on and so on and so on. But from my perspective, if you study these remedies more in depth, the point of view of Cantaris vescicatoria, and Coccinella septempuntata, the ladybug, is totally different. Cantaris is a winner, is a dictatorial, is somebody who is imposing his presence, his way of being outrageously to the others. If you study carefully Coccinella, the ladybug, you call it,
Mm.
is much closer to Pulsatilla. It's a kind of personality very dominated, not dominant at all. Somebody who is seeking a lot for a good attention. If you think about remedies like Dorifora, Dead
Mhm.
Semedineata, it is so close to Belladonna. You have some very interesting behavior that you can see close to Cantaris, but if Cantaris is so able to express his aggressiveness, in the case of Dorifora, this is very encrypted, insisted. To act the rage for Dorifora is a big issue. I can go on like this as long as you want. If you think about Blatta or Coccus cacti, is so different again. They are not at all hyperactive personalities able to do something efficient like the case of Cantaris. So for example, I agree with you. It is important whenever we say insects, arachnid, whatever you want. What do you mean by that? Because first of all, we have to define beyond the name what are, according to you, according to me, the main issues, the main theme that can define this family. Otherwise, it's just a name, not more than this. For example, Gaurang, if you think about this hyperactivity, okay, and if we agree that this hyperactivity is something that important in Tarantula, and it is that important in Cantaris, okay, beyond what is written in our books, that is not precise by definition. It is what it is in order to allow us to prescribe this remedy and to see successful in our patients. And then our patients can teach us how this remedy is. You can clearly see that the hyperactivity of Cantaris is exceptional. They can be manager. They can head the company. They can be the big boss of this. They are extremely capable of acting in an over-efficient way, which is not what you see in Tarantula, in my experience. So if it is true that both of them are that hyperactive, I totally agree on that. but the hyperactivity of the most of the insects is extremely satisfying. It is extremely efficacious. It is not fruitless. It is fruiting. It is giving out evident results. Eventually, for certain kind of insects, like the parasites, like Chimex, Pediculus, they are extremely hyperactive, but it is never enough. So even if they get results, I can be rich. I want to be rich as Bill Gates. And even Bill Gates is not enough because there is Elon Musk that can be richer than this. This is what you see in those remedies, which is not at all an issue, in my experience, for tarantula and other spiders. So at the end, I think it's not important to say insect or spider. It's important to say, first of all, what do you mean by insect? What is that specific? So if when I say this is a spider, and if I say, okay, for me a spider has to be hyperactive with this fruitless activity, has to be oppositional. If it's not like this, for me, this is not a spider. But if we disagree on that, of course, we are naming the same kind of possible family, which is not the same. Am I clear?
Yeah, yeah, absolutely. Very interesting the way you kind of gave a little idea. And in this, I want to ask you because I have read some of your cases from the books that the praxis, the books that you have written, and I always had this question when I used to read your books, especially the editions that you made, that in your practice clinically, and this is a question separate from spiders, although you can also talk about spiders. In your clinical practice, how much importance you give to physical symptoms, pathology, sphere of action? For example, we know Latrodactylus has specific action on the heart. You know, Boric writes it is one of the main remedy action on the cardiac region. You know, in Mygale it has more kind of neurological symptom. The convulsion jerkings are too much. So, in your practice, how much importance you would give it to it vis-a-vis the mind state?
A lot, a lot of importance. First of all, if I was able years ago to prescribe successfully these remedies, it was only because of the symptoms that I could find in the literature. So I did not start from the idea that all the spiders are similar. I started from the symptoms in the repertory, from the cases, and after these patients were cured successfully with the long-term follow-up, I was able to say, oh, interesting. It looks like my tarantula case, and it is different from tarantula for this. So I want to clarify that thinking that another spider has to be like tarantula could be an hypothesis, from my point of view, is never a fact. A fact is what I can find in terms of the entire symptomatology, which is very often a guide. So it doesn't mean that Latrodactylus necessarily has to be a cardiac patient. It's like to say that all your belladonna cases must have meningitis or this high fever. This is a common symptomatology. When you know this remedy is better, you can enlarge your experience and say the heart is important, there is so much more. But again, if you think about the heart, if you think about the similarity between Latrodactylus and the Pteridion, it is so interesting how much all these spiders, they produce a so interesting symptomatology on the chest. One
Yes.
more on the respiratory tract in the case of Pteridion, one more in the heart in the case of Latrodactylus. It is so interesting how much this part of our body has to do with our rhythm. We do breathe at least 16, 20 times every minute. We have a heart pulse, a heart rate of 72 more or less every minute. You know this better than me. This anormality, this perception that my pace, and very often this has to do with how often I breathe or how often my heart is beating, for the most of these patients, is irregular, is faster than the others. And the others are wrong, not me. If you think about the symptoms reported by these remedies, very often they can be very irritated because how slow is the word around. If you think about even symbolically, how breathing and heart beating has to do with our rhythm, how important it is. So I'm not saying that I give a look to heart only from this point of view. Please, this is not what I'm saying. If you read my book, the case of Latrodectus mactans could really look at the very beginning like a case of aconitum. In my experience, for example, Latrodectus is one of the most important remedies for severe post-traumatic experience. When you
Shock. It's a big shock, and
Yeah,
after that,
a shock that can be the end of your life. It's not just a shock, is it? Like when you have a severe panic attack. It's not something, it's the end, which is different. It's not just a fear, which is the mother of the fears. Okay, it's something like this. And how overreacting are to that. You don't see this so evidently in tarantula, for example. Not so evidently. For example, pteridion can be someone who is constantly trying to show how fast, how clever, how many different kind of sportive, dangerous activity he can do, even if he's afraid. They do that in order to see, I'm capable of doing this. If you think about Orthodectus from patients, not from what is written in our books, it's the opposite. They seem Gelsemium sometimes because of the fear of doing something too scary. But this is not written in our books. You can be happy, as you said, if through those clear physical symptoms, we are so lucky that they do exist, we are able to prescribe this, and only our patient can teach us this. Am I clear, Gaurang?
yes, yes, and I like one of your addition about lateral which I see in my cases also exaggerates one symptom. It's a very exaggerating and majorly also slightly hypochondriac kind of state, and I've seen so many cases who require lateral of the spiders. It's fascinating the way you wrote about it.
I think so. I think so.
So, talking a little bit more about this, um, in clinical practice, Arania ixabola and Arania diadema can also sometimes look very similar.
No.
Ixabola has no, yeah, for us. So we want to
They
know
are, they
from
are called Arania, but they are not similar at all.
Hmm,
One of the most interesting aspect, you know, it's in some way misleading.
hmm,
The issue that our remedies are named with something similar that could make us think that because the name is so close, the remedy has to be that close. From the point of view of the exaggeration of symptoms, from the point of view of being so oppositional, I think that Aranexobola, in my clinical experience, I don't have cases for all the spiders of our materia medica, but considering the one which I know, Aranexobola, not by chance, is reported in our literature as extremely provocative.
hmm,
So what you can see is how evident, I insist, how extreme, how outrageous is their capacity to do whatever is possible in order to drive you crazy.
hmm,
I remember one of my very first cases of Ixobola was a girl with a Tourette syndrome. She found out that it was as if almost nothing was really irritating her mom. Unless she decided to poop on the floor of her room, to take her poop with a spoon and to put this all over the wall of her room. I mean, this kind of extreme kind of behavior, this kind of doing something which at the end, as I said before, it is self-destructive, because I don't think that the most of us can enjoy to have your stool around your wall. It's not such a pleasant situation. The most of us prefer to use incense or something beautiful to smell. Okay. But to do something like that, so much injury to yourself, in order to punish your mom is so interesting. The capacity of detecting whatever can be the most effective situation in order to drive you crazy, behave so openly, is a characteristic for Ixobola.
Mm.
In the edema is much more elegant, is not so openly done. I remember my very first case of aranea diadema was so interesting because both of the parents of this boy were physiotherapists.
Mm.
So they mainly had to do with patients with osteoarticular kind of diseases, and they were considered one of the best in their town. Which kind of disease this boy decided to develop? A kind of arthritis, which drove crazy these parents because they were so capable to help so many other patients like this, but not him. This family had a very hard time to cope with the grandfather of this child, who was a kind of anarchist, a complete different kind of person, and he was in love with his grandfather, who was his mentor, his most important person in his family, and nobody in this family liked this guy. So again, what I think is important is not just to mention, as I tried to do before, this kind of positional behavior. This more or less belongs to each one of these remedies, but how it is acted, how intense, with which kind of strategy it is done, I think is different from each remedy.
Each remedy will have a different strategy of
Different way
all
to
the
do that, yes. So if you
yes.
think again about what you said before, the clinical pathology, which I think is very interesting, important as well. In the case of aranea edema, I've seen a lot of cases with autoimmune diseases affecting the joints, the muscle, and so on, even precociously, which is not what I've seen in Ixobola. In Ixobola is much more behavioral and neurological than this autoimmune. But of course, Gaurang, we need good and more cases in order
Yeah.
to underline this. I'm not telling at all you that this is the truth. This is what I've seen, and this is what I'm suggesting you, what I'm trying to share.
Just a couple of more questions. So miasm is a biggest question that our participants have about these topics, and it's a crowd favorite kind of question. And one does feel when one reads the Materia Medica books that, of course, spider remedies remind you a lot of tubercular miasm. I mean,
Hmm?
that is an obvious feeling that a homeopath has. But it's very interesting, sir, because if you read Arania diadema, one reads it from the classical books. They write a lot about hydrogenoid constitution, and there are a lot of patterns that reminds one of not tubercular miasm only, maybe perhaps a slightly more psychotic miasm pattern. So in your clinical practice, how do you look at miasm in connection with spider remedies, and how do you kind of evaluate?
Probably I have to give you an answer that you will dislike. I do not use miasm at all.
Mm.
I think, again, as I said before, that first of all, we should clarify to ourselves what doesn't mean this word. Because from the time of Hahnemann to nowadays, the word miasm was used in so many different ways that it means something completely different. The attempt by Hahnemann was to try to explain, according to his time, why human beings develop a certain kind of diseases according to certain kind of possible infection. And even the concept of infection at this time were not as we know now. Even bacteria and viruses were not known at this time. But little by little, the word miasm, from the time of Hahnemann on, became another classification, another way of grouping remedies. If you think about what was done by the South American colleagues, for example, following Ortega or the others, for them, the idea of this psychotic means this kind of symptomatology, syphilitic means that, and so on.
Mm.
It's another way of classifying. So correctly, other homeopaths later on, they said, oh, please, there is also the tuberculinar way, there is also the carcinocytic way, there is also the leproid way, there is also this other, which is another classification. I don't have anything against this idea. Again, first of all, I think that we have to define what does it mean to be psychotic, syphilitic, leprous, or whatever. If you say that in the case of Aranea diadema, is much more common to find out this kind of genoid symptomatology, this kind of psychotic symptomatology in the classical way, it is absolutely true. It is so interesting, as I just mentioned before, that it could be common this way of affecting your family with a difficult relationship with food. So the anorexia is a common behavior. And I said before, not always. In the case of Arania, much more commonly you find out overeating patients than poor eating patients. Again, the goal is the same. How can I drive you crazy? I can drive you crazy overeating, I can drive you crazy not eating at all. The most important issue is to drive you crazy. The manifestation, the way I behave this is different. So it's much more common for the physical point of view to see somebody who is overweight, who is retaining a lot of fluids and liquids in the case of Aranea diadema instead of Latrodexus or Pteridium. It is very different.
In your understanding, sir, kind of course, you are now in a different kind of a phase in your clinical practice. But we have a lot of students, the young students, younger generation students who are perhaps in the first 5 years of their homeopathy from different parts of the world, India, Turkey, Brazil, France, etc.
Good.
So for them, basically, my question is for through them for you, is that how and what would be the books that they should be studying? How did you start? Which were the books you studied? Could you tell us a little bit about your initial studies, literature that you use, because that really will be practically helpful for my friends here.
Very good question. I can tell you that being an Italian, I was a desperate student because in Italy there were practically no schools of homeopathy. And luckily, I was able to have enough money, even if I was very poor, in order to use my money to travel and to see seminars. This is the reason why at the very beginning I told you that I belong to another kind of, of experience, because at my time I had to travel a lot in order to see other very good colleagues all over the world saying what I had to share. At my time, when I had my school in Boston, in Bologna, it was a 3 year course where we met 3 times a year for 7, 9 days, something like this. Something like that today seems to be almost impossible. And I'm very sorry for this. I could give you a very bad question, very bad answer, sorry, which is I do believe that each one of us has his own style, his own way of thinking. Each one of us is deciding this kind of school, this kind of homeopath to follow because they resemble much more our own way of thinking. I don't think that there is one which is better. I think there is one which is closer to our way of being an homeopath. I think that there are 3 things that should be always respected. Each school should tell you something in order to prescribe remedies successfully, which means to treat successfully your patients. Possibly this kind of being, of working, of proceeding should help us to add a little brick to the building of the temple of homeopathy, which means that it's not only important to treat successfully patients, it's important to make this medicine grow, even from the point of view of philosophy and other theories. And also, last but not least, this medicine should be able to satisfy you, which means I'm following this method because it makes me happy when I go to my office and I start to see patients. If I work like this, like, Skolten, like Mangialavori, like Rajan, like whoever, I feel a joy in doing this. It's a kind of practicing which I love. What could be not so nice to say is that my main teachers were my patients. I started from a very strict approach to medicine because I was grown in the university. And for me to be really consistent in our observation was extremely important. At my time, 40 years ago, there was a gigantic discrepancy, which is not what is happening now. Because on one hand, in our books, in our schools, we were taught, educated that each patient has his own individuality and you have to find out the best remedy for him. On the other, I was listening to colleagues saying that you can work with 2 remedies, silicia or calcarea carbonica, others with 15, others with 30. And using the repertory when I was a student, I was able, because I was lucky at the beginning, not more than this, to prescribe successfully Arania diadema. I remember that I was invited by George Vitulkas many years ago. It was the beginning of the 90s to Alonisos because he heard that I was prescribing remedies like this, and he wanted to know how that it was possible. And I remember that when I give my speech in my outrageous poor English with those other colleagues, they even didn't know which kind of remedies I was prescribing. They know that probably the name did existed. But it was because I was using precisely the repertory, and I was thinking from the very beginning, like it happens in the university, that our books are never precise. Even when you study conventional medicine, tuberculosis, it's an hypothesis. You have a tubercular patient, not a tuberculosis, which is different. And each patient with tuberculosis has some common symptom of tuberculosis and something specific, which is his own way of being tuberculosis, which is what we should do homeopathically speaking. So books of Farrington, books of Ashun's, book of Julian, and so on. So colleagues thinking in terms of remedies that looks like, that are similar to. I remember when I discovered that somebody observed that Lactuga virosa is so close to opium when opium doesn't work. It was such a beautiful suggestion. So I think that at the end, there are homeopaths, for example, Beric, I think, was one of my favorite one. He did an excellent work because the symptoms reported in his books,
Clinical symptoms.
very seldom you don't see this in this patient. But it's not an extended way of thinking about a patient. If you think about fantastic colleagues like Clark, for me, Clark is an idol because think that he was able at this time, when even the telephone did not exist, to write to so many colleagues in order to ask them, please send me your information, and I'm building a dictionary. One of the few homeopaths who was able to build a dictionary, an encyclopedia, where he was able to quote what everybody told him, not being bombastic that I know from Abel Moscus to Zizia, and I wrote the entire Mater America as if I always prescribe successfully of these remedies, which never exist.
And the best thing is he has put cured cases, of Grimmer, of Burnett, and that makes
This
us
is honest. This is an honest way of reporting what you studied and what you can see from your patients. So all these colleagues, all these masters like Berike, like Clark, like Julien, like Ashuns, they were sharing their experience. This is wonderful because, when, even if you are an excellent homeopath and you write a book of Materia Medica where you have remedies from Abelmoscus to Zizia, this is not true. If you are excellent, you can know 300, 400, 700 remedies, okay? Not more than this. So please share with us what you have seen. This is the treasure, not whatever you think that you learn from others, which is reported and copied from another book.
True, true. That's why we like your book a lot. We actually love your book because there's so much of originality and something that we can kind of go to when we don't find in other literature. I told you, I absolutely am in love with your this editions because I confirm them and they are just, and not just me. I discuss so much with my other colleagues, and it's just fascinating to find those remedies you don't find anywhere, and to confirm we open and we could find that in the edition. It's just fantastic. I'm going to take just